Welcome to Health Talk. Today, we're going to talk about rhinoplasty nasal surgery. We have with us today Dr. Chase Lay, a facial plastic surgeon in private practice in San Jose, California. And we also have with us Robert Burt, who will also help me interview Dr. Chase Lay. Tell us, what is rhinoplasty?
Rhinoplasty is just a general term for surgical procedures that are utilized to either reshape the nose for aesthetic purposes and just as often reconstruct things internally so patients can breathe better, function better, that sort of thing.
So nasal surgery and rhinoplasty, are they about the same? Because nasal surgery, you treat things like people who can't breathe and all that. You want to tell us a little bit about that?
Well, sure. Yeah, I mean, just about anything you do on the nose, I guess, could be considered rhinoplasty. A lot of times when people think about nasal surgery, they may be thinking of things for breathing or snoring. Sometimes there are even minimally invasive things that you can do for patients in the office to help with their breathing some. So it just depends on what the patient needs and what they're looking for. Sometimes they're looking for a combination of improved function and improved aesthetics, or at least what they feel would be an improved look for their nose.
So how often do you actually have patients come in with a nasal or breathing problem, and then you also kind of give them a cosmetic procedure to go along with that?
I'm not a particularly sort of hard sell or pushy person. So I don't often project my own, thoughts or opinions regarding the aesthetics of a person's nose to them, especially when they come in for something regarding breathing, or maybe they just had trauma and they've got a crooked nose and we want to fix that. But probably about 20 to 30% of the time when a patient is interested in fixing something functionally in their nose, like performing something called a septoplasty to straighten up the divider of your nose, so they can breathe better. They're also interested in making some small changes, making their tip more defined, rotating it up. In my Asian patients or other patients with a low bridge, sometimes they're interested in augmenting the bridge and making it taller. So it varies, but probably about 20–30% of the time.
So the most famous person in America who's ever had nose surgery is Michael Jackson, because he's changed the shape of his face and augmented his bridge.
Yeah.
And that was a complicated procedure because you had to change the anatomy and do a cartilage graft or something.
Right, yeah. In Michael Jackson's case, I mean, even when professionals like me look at him and we look at photographs of him as a child and as a teenager and in his 20s and so on, over time, a lot of the changes that you see in his nose were revision surgeries on top of revision surgeries, and each subsequent revision surgery becomes tougher than the last, because when you're placing cartilage grafts in a scar bed in a nose that's already been operated on, the vitality and the take or survival of those cartilage grafts is much more variable. In addition, he had a lot of skin removed. He had alarplasty, which means he took a wedge out of the base of his nose to make it look more narrow. And a lot of the changes that you saw in his nose later in life weren't from additional surgeries. They were just age-related. If you have very aggressive rhinoplasties performed, like reductive rhinoplasties like he did early in life, as you age, the soft tissue, the skin, the envelope around the nose gets thinner. The cartilage grafts, synthetic implants, whatever it is that you've done under that surface starts to show, and it will literally start to just shrink up like shrink wrap.
And that's why his face changed and degenerated.
Something like that, yeah. He just age-related changes on top of a lot of very aggressive surgery that was performed multiple times over his lifetime.
And also, as an African American, he had a risk of keloid formation. So therefore, it was very hard for plastic surgeons to manage his healing, I'm sure.
Technically, yeah, he's at higher risk for visible scarring and hypertrophic scarring. True keloids, where a scar is actually growing out of the incision line, are pretty rare, even in African American patients on the nose in any case. On the ears and other parts of the head and neck, it's more common. So
because you do internal surgery up through the nostrils.
Well, you try to as much as you can, and it just depends on what the patient's requirements are. But any of my patients of color, Asian patients, Mediterranean, African American patients, the external incisions can be, you have to watch them very closely, close them very closely, tightly, meticulously, and be very ginger with the tissue while you're performing the surgery.
So tell us about the most common rhinoplasty request. Is it people with a parrot beak deformity, or what? You have pictures to show us.
Oh, sure. Yeah, so probably in my practice, it can be pretty variable because many of my patients are Asian, actually, and so in this case, you mentioned a parrot beak or a polybeak deformity, and this slide here, this young man, he's got a kind of a large hump or bump on the end of his nose. And this is actually, in his case, not a nasal bone that needs to be reduced, but it's a bunch of scar tissue and cartilage. And I actually had to take cartilage from his ear and reconstruct this entire dorsum just to get it straight again. And
was it from trauma? He had
had surgery with another surgeon in the area who advertises that he operates on Asian patients a lot, and we didn't really know what was in this young man's nose, and it took me about 4 hours to fix it. When I finally got in there, what we discovered was that surgeon had left a rolled up piece of surgical plastic, a netting, to try and augment his dorsum, and just left it there on purpose to try and help this rounded polybeak appearance, and it just resulted in a big phlegmon or chunk of scar tissue that had to be removed, and it had to be reconstructed with cartilage. But probably just all comers across the United States, the number one thing that people are looking for when it comes to rhinoplasty is something reductive. They have a hump where they feel it's a little bit crooked. So they want to reduce that hump, look a little bit better on their profile, and that sort of thing.
And usually a lot of young girls typically have it at age 17, a reductive, especially, if they feel they're about to go to college. This is their high school graduation present.
Yeah, I mean, in my office, and probably this would be true in most offices across the U.S., there's different age groups that kind of come in at different stages in their lives. You have students who are coming in right as they're finishing high school. They've got a few months before they start college. They're going to go to a new place. People don't really know them, so they can make this change very discreetly. Nobody really knows what happened or what they looked like before. And then a lot of patients actually come in as they're finishing college, and they are trying to change characteristics of their face, eyes, nose, whatever, and they feel like that will give them an edge professionally when it comes to getting a job. I mean, just last week, this was an eyelid case, had a young woman who was very, very young, who apparently had skipped high school and was graduating law school from Yale. And she's really young, she's kind of an unusually bright person. But in order to give herself an edge as she was going out into the world with as impressive a resume as she had, she was making some small modifications to her face that she thought would make her look more pleasant, more inviting, and warmer when she was interviewing with people. So lots of things like that.
You mentioned that the procedure with that patient that you just showed us took about 4 hours.
Yeah.
So how long does a rhinoplasty normally take?
Most rhinoplasties that I perform, just on, no matter whether it's augmentive, cartilage grafts, reductive, if it's their first rhinoplasty, it usually will take me anywhere from 1 to 2 hours. I get a lot of revision work. I started doing a lot of revision work early in my career, and it's gone well, and kind of gained a reputation for spending a lot of time and effort on these cases. And those revision cases, I have to harvest cartilage from the ribs or the ears and then place it, shape it, replace it, reshape it. And it can take me anywhere from 4 to 6 hours. Sometimes if I'm lucky, it takes me 2.5 or 3 hours. But those are pretty tough cases, and the outcome is a little less reliable than your first rhinoplasty. So the first rhinoplasty or nasal surgery that you get, you want to go to the right person, do your research, and hopefully just do it once and never have to do it again.
So you're doing a lot of revision. So how many patients just have like one rhinoplasty and then never go back for another revision?
Most patients.
Okay.
Most patients do. And some patients do come back and they want to make small modifications, not big modifications, so it's not a true full revision. And that a lot of times just comes down to time and resources. If it's a cosmetic procedure that they want to revise and they have to pay out of pocket, if they have the money and they have the time, they'll do it. Even if it's something small that they want to change. Patients who don't have the time, they're too busy, or financially it's not practical for them, they'll just, ignore those small things that they don't want to change and just move on. But revisions are probably run anywhere from 10 to 30% in each practice across the United States, depending on what type of nasal surgery that person specializes in. But it can be variable, yeah.
So of men who have cosmetic surgery, rhinoplasty is high up there. So more men are coming in now, and more men are coming in than before for plastic surgery in general.
For sure.
Can you comment about what the men ask for and what the women ask for?
So again, people, different demographics, different age groups will come in at different times in their lives to change different things. But men, a lot of times, men will come in who are finishing college or they're in their 40s and 50s, particularly in the Bay Area, and they want to make a change to their face that makes them look a little sharper, a little more masculine, a little younger, because they feel like they're having to compete a lot with their younger counterparts, especially in Santa Clara County.
How can the nose make somebody look younger? I thought it would be a facelift.
People have heard these old stories about how noses and ears get bigger with age or they grow. And that's not exactly true. Everything on our body sort of sags and gets a little bigger and gets a little longer as we get older. So a lot of times the nasal envelope, especially on Caucasian people, that skin thins out, nasal bones start to show. You'll notice that this mid portion of the nose starts to get an hourglass appearance. So you'll do things called spreader grafts. You'll place cartilage in this mid vault. You'll take down the nasal bones, or you'll even take fascia or tissue from behind the ear, implant it on top of that so it has a smooth, more youthful look. The tip will actually start to droop down with age. Some people will call that a witch's nose, and that's true in men and women, but it can be particularly noticeable in men. So they'll make a small modification just to rotate their tip up. They may have excellent bone structure and look great otherwise, but this is really giving away age, and it also may, or at least they may feel it makes them look a little bit harsh and unapproachable, so they'll make these changes so they feel like they can communicate more effectively with their coworkers, board members, whatever the case may be. But rhinoplasty is probably the number one or number two request for plastic surgery from men coming into the office. A close second would be chin augmentation.
So in these men, let's say in their 40s and 50s, they want to change the shape of their nose. What happens to the men with kind of a bulbous tip nose? Do they come also in the 40s and 50s because that becomes more bulbous?
Yeah, it starts to become a little more noticeable as this area in the middle portion of the nose right here starts to thin out. The tip looks a little bit larger, kind of just sort of sticking out there on the front of their face. So you can do trimming of the cartilage of the nasal tip to refine it, and also raise the tip. You can just literally put structurally designed pieces of cartilage in the base of the nose here called the columella to hold that tip up. And a lot of times you cannot tell that person's had surgery. You can do these surgeries with internal incisions. There's nothing on the outside that's been performed really, and nobody's the wiser. They really still look like themselves, but the nose looks a little different.
Do you all use cadaver cartilage, or you use autologous? You have to graft it from someplace.
I usually will use the patient's own cartilage, or at least whenever I can. And in cases when people are having revision surgeries, if that cartilage in their ear has been used before, I may have to use cartilage from their rib. Using cadaver cartilage is fine. I mean, it's actually a pretty well-established technique and source for cartilage for large reconstructive procedures on the nose. It will resorb with a higher percentage, or basically just sort of reduce in volume, than your own cartilage. And there's different opinions or studies that show it. Some say the resorption rate is 20 to 30%. Some say the resorption rate is more than that. But it is a reliable source of cartilage for surgery on the nose.
So I have a bit of a bulbous nose, but I like my nose.
Okay.
But if I were to come into your practice, what sort of things would you recommend to a patient like me?
Well, I mean, if you were asking for if you were asking for changes, I'd make a few recommendations. If you weren't, I wouldn't make any. But I'd probably start out by talking about how we could better refine your tip. So actually, I'll just run a simulation right now. We'll take a quick photograph of you. Just lean over here if you would. Okay.
Real life here.
Turn and face
Turn
me.
this way, okay.
Yeah. And there we go. Okay. So I don't know if we can get a close up, but so we can see his face and his tip right here. And I'll just make a few changes to that real quick. But in your case, the surgical maneuvers that I could do or perform to make your nose look a little bit better defined may not require external incisions. I could do what's an endonasal approach, where you make incisions inside the nose, and I simply conservatively trim the upper portion of the cartilages of the tip of the nose. Those are called the lower lateral cartilages. So, and just for the sake of the simulation, we'll make the change kind of dramatic so it's kind of easy to see, on camera. But so I've got his nose here.
I'll tilt it a little bit down.
Oh,
yeah,
I'm
that's
sorry.
it.
Got the nose here. We'll start out from the beginning. And bring in this side wall here, bring in this nasal tip here. Define the bridge a little bit. Probably take in this area here and make sure everything is in the midline. And then side by side, it may not be that noticeable on camera. I don't know if you can zoom in on that. But performing what's called a cephalic trim of this nasal tip cartilage can make the tip look a little more defined. And surgery like that, if we weren't interfering with your nasal bones, if we weren't changing the cartilages of this middle vault or the upper lateral cartilages, you would probably be able to recover and go back to work within anywhere from 3 to 7 days. So. And you'd certainly be able to work from home if you were in a...
So it wouldn't be a huge inconvenience if I wanted to have something like this?
Not for something like that.
Usually the nose is packed post-operatively, right? There's packing.
It can be, yeah, it depends.
Okay. And then that packing comes out the first post-operative day?
Usually. So packing that, in the past, when large rhinoplasties were being done in the sense that nasal bones were being changed, the septum on the inside of the nose was being changed. Just take a quick look at so this bit of anatomy here, this is the internal septum. These are the external cartilages here. This is a view of it from the front. But if you're having to change the internal structure of the nose as well as the nasal bones and the cartilage, sometimes there is something like packing. People used to pack Vaseline gauze in the nose, but they really don't do that anymore. There's biosynthetic packing that you place in the nose, it dissolves and it goes away, and the surgeon can just suck it out basically the next day or a few days later. In some cases, you have a silicone splint that's inside the nose that may stay anywhere from 3 to 7 days. But if you're talking about a rhinoplasty that basically just includes reshaping the tip or augmenting the dorsum, there's no internal packing. The need for internal packing in rhinoplasty now is a lot less than it was in the past, or at least it's utilized a lot less than in the past. People recover more comfortably from their nasal surgery than they used to.
So then post-operatively, he would just then have like small little ice packs, like frozen peas, to shape his nose, just to
Pretty
comfortable?
much, yeah. Actually, the best ice pack for the face is a Ziploc bag of frozen peas or corn, because you just drop it on there. It takes the shape of your face, and you don't have to do anything else. All the pre-made ice packs that you can buy at different pharmacies, they're kind of hard to conform to your face, and they actually put more weight on the nose than I would like. So in many cases, I actually don't want the patients to put ice packs on their nose, or at least early on, depending on what was done
Because
during the
it's
surgery.
taking a new shape. You don't want anything to change that.
Right, right. And there's, patients wanting to do the best they can for themselves, wanting to keep swelling away. Sometimes we'll do things like try and sleep with ice packs on, and that is, ill-advised. You can imagine you can actually give yourself frostbite, especially on skin that's been operated on. So ice packs are kind of plus minus in the nose. Sometimes they're used, sometimes they're not.
And then what is more common for women to ask for?
Women, it depends.
Two ages, right? The teenagers.
The teenagers, younger women, Caucasian, Mediterranean descent, European descent, they're usually looking to reduce a hump, make a nose look straighter, make it look a little softer or more feminine. This junction here where cartilage meets bone, a lot of us, Caucasians will be able to see these two little points of light here where the nasal bones are sort of prominent. A lot of women want to eliminate that, or at least smooth that out, and then just defining the tip, making it a little bit sharper. Now, in my practice, again, which is largely Asian patients, it's usually augmentation of the dorsum, refinement of the tip, and reduction of the nasal base.
And then for ladies in their 40s and 50s, what do they ask for?
Basically the same things.
The same things?
Yeah,
okay.
basically the same things. And
because they also get the bulbous changes of aging.
Right.
And their face is drooping, and the nose is also drooping.
Right, yeah. So, but the things that you do in those situations are just a little bit different. You may actually add more soft tissue or collagen, sheets of collagen into the nose in older patients, just to make sure that the cartilage changes that you make, the bone changes that you make underneath, are not visible through thinner skin in an older patient.
So most of your patients are coming in for cosmetic surgery, and they're paying out of pocket.
Right.
So what about patients that come in after having a traumatic injury to their nose? Do they go through insurance, or?
Yeah, I mean, if patients are insured, usually it is going to cover a traumatic deformity of the nose. And one, he was actually a soccer player in the area. He tells me his nose was better after surgery than before, but I have no idea because it was so distorted when he came in. But he was hit in the head by another soccer player when he was going up for a ball, and it literally just smashed his nose sideways. And so I had to reconstruct the septum, the nasal bones, just a little bit of everything, and it was all covered by insurance. So yeah.
And then what about congenital nasal deformities?
Congenital nasal deformities.
There are not that many midline. All those would be the cleft palate people, children.
Right.
They go to the probably the medical centers.
Generally.
Yeah.
So cleft lip, cleft palate, these things are always done in stages. There's a stage of cleft lip, cleft palate repair that's done when the child is very young, and then there's additional stages of bone grafting, dental work, depending on how bad the cleft palate is. So if they have a cleft lip that includes their alveolar ridge or this maxillary ridge where their teeth are, that extends up into the nasal floor, and there can actually be a hole in the nasal floor. So with a first stage operation of cleft lip and palate patients, a lot of times you do try and incorporate some type of rhinoplasty, at least to get the alar base, or this rim here that is on the side of the cleft or the defect, into the midline, so that these things are kind of growing at the same rate as the child in the appropriate position, and those things get revised multiple times, a lot of times, as the child gets older.
So let's say people have a saddle nose, or they have to have some sort of augmentation.
Mm-hmm.
Let's say if I have an Asian nose, I had heard that there's resorption of the cartilage,
Mm-hmm.
and that they have to be redone.
Sometimes, yeah.
Right. So what is that risk? I mean,
It's that one is, and it's hard to describe that one as a risk. You know, it's sort of an unfortunate event if your cartilage doesn't survive as much as you would like. I think what happens a lot of times is surgeons who are not comfortable with cartilage grafting, who don't do it frequently, don't put in grafts that are large enough. You measure the success of a rhinoplasty in weeks, in months. No, you don't. You measure the success of a rhinoplasty in months and years. So if you're coming in to get an augmentation rhinoplasty, if you're an Asian patient, I'm putting a cartilage graft on your dorsum, I'm putting a cartilage graft in your tip and at the nasal base. To augment that, I'm going to put in more cartilage than you need, because in 6 months, that will have settled down and be in the position that we want it to be in. So you do rhinoplasty for the long haul, not the short haul.
now, there must have been change in the type of cartilage that you implant, because now they're cartilage sheets and collagen sheets.
Mm-hmm.
So has there been change in the technology of how you can do these small implantations in a small area?
Not exact, just technique is a little bit better, a little more reliable. There's more, it's a lot of work to do cartilage grafting, and some rhinoplasty surgeons just aren't willing to do it because they can get a pretty good effect or a pretty good result early. But now it's being taught more, it's being lectured on more, people are using it more, so the techniques have improved. The donor collagen, the donor cartilage that is used is probably a little bit better quality than it used to be, at least with regards to safety, because there's always a chance that it could be infected with viruses and other things that you would not want in your body. That's always a risk. But they're used with better effect now because people know to put in a larger graft than they once did, or surgeons know better now because they know it's going to resorb pretty significantly over time.
So the rise of nasal surgery in America probably coincides with, I guess, more of these procedures being available everywhere,
Yeah.
and the technology. We have a minute and a half. What is our take-home message for our home audience and our studio audience? What would you like us to leave with?
Just if you're considering rhinoplasty, whether it's reconstructive for function or after trauma, or if it's just purely cosmetic and you breathe fine, you're probably best off going to somebody who does a lot of rhinoplasty, has a lot of photo evidence of the rhinoplasties that they've done. And probably a facial plastic surgeon would be your best bet, because they have a base in ear, nose, and throat training, and they're always going to have the function of your nose in mind when they're making aesthetic changes to your nose. So do your homework.
In our remaining minute, what are the things that you want the studio audience to remember when you're thinking about when you should have it? Like, should we rush out and have it today? Are you age 20, age 40, and that you're in good company? People are considering it. You know, it's not that you have to be alone. 250,000 are done a year.
No, yeah, you want to do it when the time is right in your life. You don't want to do this when there's massive life changes coming. You don't want to do it for your 40th birthday, or you probably don't want to do it for your wedding, things like that. You want to do it when your life is pretty regular, you can afford it, you can afford the downtime, and you don't have a lot of other stressors in your life. So you want to do it when you're in a good place, not when there's a lot of transitions in your life. I'd say that's probably...
Not when you're about to do a world tour and do moonwalk video.
Probably not, yeah, probably not.
So thank you, everybody, for joining us. If you have questions, you can reach Dr. Chase Lay. His phone number will be at the end of the show. And thank you for joining us in Health Talk.
Thank you.